evening. My name is Jay Wong. I'm a junior pathology attending in the United States. I go over cases almost on the daily from head to toe. If you are interested in that, consider giving a like and subscribe. Without further ado, thank you to Pathlibrary for this kidney tumor case. So clinical information is a 50-year-old male with this most likely solitary solid cystic mass. So we see areas of fibrosis, and this tumor has a papillary architecture, and it is solid and cystic. Adjacent to it are some normal vessels and tubules, as well as glomeruli here and there. Alright, so these cells are clear. Their nuclei are relatively inconspicuous. The nuclei are also apically polarized. They're not facing the basement membrane, but they're kind of on the apical surface, like you can see here. And then we see papillary structures here. Alright, so Pax8 should be positive because it's a kidney tumor. CKAE1A3, this pancytic keratin, should be positive. CA9 should be a not box-like membranous, but cup-like membranous. Yeah, just like that, a cup-like membranous. CK7 should be positive because it is not clear cell renal cell carcinoma, which should be bloodier and should have at least a little bit more atypia. CD10 is negative. So this is clear cell papillary renal cell tumor, okay? It used to be called clear cell papillary renal cell carcinoma, but this has a really good prognosis, so the recent iteration of the WHO changed it to tumor. So it'll have this tubulopapillary architecture, cystic proliferations of relatively monotonous cells, and the nuclei are positioned at the apices near the lumen. And that CA9, it's got to stain cup-like. That's very testable. Some differentials, the clear cell renal cell carcinoma, CA9 would be box-like membranous. It'd be CD10 positive. It would be much bloodier. Papillary renal cell carcinoma rarely has clear cells, lacks apically oriented nuclei. You can see some foamy macrophages interspersed. And multilocular cystic renal cell neoplasm with low malignant potential. This is entirely cystic without any solid expansile growth. So these tumors are small and no metastases have yet been reported. So clear cell papillary renal cell tumor. I hope y'all enjoyed this. I will see you next time. Bye.